Welcome everybody to our May 2024 Health Equity Webinar Series. And we're doing it today on education and health. As you all know, I'm Lydia Isaac. I am the Vice President for Health Equity and Policy at the National Urban League. And I normally lead these sessions, and I'm really excited today because we have three fantastic panelists who are joining us to talk about the connection, as we all have talked about throughout these webinar series, about the social determinants of health and the connection between education and health. And so our panelists are going to introduce themselves, but I'm going to just say their names, and I'm going to get all of these correct. Probably not, but I'm excited that they're here. I'm going to start just because they're right to my right is Calaia Jackson, who is a doctoral student at the University of Delaware, and also a health policy research scholar for the Robert Wood Johnson Foundation. Going down is my dear colleague is Horatio Blackman, Dr. Horatio Blackman, who is the Vice President for Education, Advocacy, and Access here at the National Urban League. And so excited to have him here and for us to talk about the connection between our work. And last but not least, because she's doing wonderful work, is Dr. Jonetta Mpofu, I think I got it right, who is with the Office of School Health at the CDC. And Dr. Mpofu is going to talk a lot about the work, not only the clinical work that happens at school-based health centers, but the larger work that CDC does to think about the well-being of our students. So I'm really excited to have this panel because, you know, we think about education and most people say, oh yeah, the kids got to go to school, they got to have education, but there's a huge link between education and health, right? And understanding that link and why it's so important, not only for health literacy aspects, but also for how brain development happens for young people, also for their mental health and what we're happening out of school time, and making sure that our students are not only physically happy, but mentally happy, and wellness. And so that's really important for us to think about those connections. And so we're here to have a discussion about that. And I'm really excited about panels. So I'm going to ask each one of them at first to introduce themselves and to talk about a little bit what they're doing. And Calaia's place is going to be about her research. And Dr. Mpofu is going to be about what's happening at the CDC. And for Dr. Blackman, is going to be what he's doing with the National Urban League. So I'm actually going to start with my colleague, Dr. Horatio Blackman.
Certainly. Thanks, Lydia, and thanks for inviting me to be on this webinar. Hello again, everyone. My name is Horatio Blackman. I am the Vice President of Education Policy, Advocacy, and Engagement at the National Urban League. I've been with the League for about 3 years now, and I lead what is called our Equity and Excellence project, which is our portfolio of work around education and youth development policy and advocacy. Briefly, my work is centered, as I said, on engaging our communities, but also local, state, and national leaders on issues related to youth development and education, specifically around issues of educational equity for Black and other underserved youth and their communities. So we really cover a lot of issues both in the out-of-school time space and in the K-12 space. But as Lydia, introduced, we are trying to, de-silo our efforts here at the National Urban League to talk about the intersections between education and the workforce, education and health. And so I'm just really excited to be able to be part of this conversation today.
Calaia.
Thank you so much for the introduction, Lydia, and you pronounce it correctly, Calaia. Yeah, I'm Calaia. I'm a graduate student, 4th year, a PhD student in the Public Policy and Administration PhD program at the Biden School here at the University of Delaware. And I study education and social policy, and specifically thinking about the ways that education policies themselves serve as a social determinant of health and can really create the systems and environments that students have to really survive through to begin to thrive in the workforce. And so I think a lot about the experiences that students have in schools, specifically with racism and bias and educator bias and discrimination, and how those experiences can be detrimental for the political, civic, and health outcomes for students, really thinking about, political participation, but as well as the social incorporation and inclusion. And so I'm really excited to be here to talk about, the ways that education is health is multifaceted. It's not just, physical and mental health, but there's social and emotional health and areas that are understudied that we can really make strides in and help to, to further develop healthy students and communities. So thanks.
Fantastic. Dr. Mpofu.
Good afternoon, everyone. And Jonetta is fine, Lydia, so we can just do Jonetta. But nice to meet everyone. I am Jonetta Mpofu. I am the acting chief for school-based surveillance at CDC in our Division of Adolescent and School Health. And I've been at CDC for about 12 years, and I've been in adolescent school health coming up on 5 years. And what we do in DASH, we call it, is really support schools, districts, teachers, and ultimately students through several arms of our work. And so I'm in the surveillance branch, and we host several surveillance systems that go out nationally around the country to students. And really that provides the data, right? Data on a variety of health issues. Calaia mentioned racism. We have racism, school connectedness, one coming up on unfair school discipline. And those give us that touch point for how are students doing, mental health. Our other programs in the division focus on things like programming, right? Programming, research, and how to really support schools and leaders, school leaders and districts in managing issues that come up with students and trends that we're seeing in surveillance and data. And so we support several programs in schools focused on mental health, school connectedness, promoting positive environments and promoting positive factors to help students achieve learning at a higher level. So that's us in a nutshell, and I can get more into the nitty gritty of our programs and some of our and what our data are showing as we get further into the discussion.
Thank you, Jonetta. Okay, we're gonna go with first things. I'm good with it. But as somebody has always told me, you earned a degree. I'm gonna use it because people do it to me all the time too. Because I'm like, oh, just use Lydia, and they're like, nope, you earned it, you deserve it. So I want to at least acknowledge the earned and deserved. And Calaia is gonna get there soon, and so we're gonna be calling her Dr. Jackson at some point very soon. And I'm excited about that. So I just want to start off with just for this audience a basic. For all of you to kind of, from your perspectives and how you're thinking about this, why is education so important for health? Just our basic, getting into the connection between education and health. And anybody can take this and anybody can start.
Sure, I'm happy to kick it off. Education significantly impacts various aspects of people's life, including their longevity, their health habits, their socioeconomic status. And I know we'll unpack a lot of that throughout this conversation today. But the level of education someone achieves shapes their opportunities, their job prospects, their income, all which play a crucial role in shaping their overall well-being. And so, it affects how long we live and how healthy we are, our chances of getting that good job and making, a family sustaining wage. It's kind of like a key that can open doors to better opportunities and a better quality of life. So the more education you have, the better your chances are, again, of living longer, because you may live in a healthier neighborhood and have more access to resources like pharmacies, grocery stores, green spaces to be out and play in, less polluted environments, and having the capital and time to access and navigate our healthcare system. So there's this pretty tight linkage between education and health.
I have nothing else to add. That was awesome, Dr. Blackman.
Such a very comprehensive answer. Yeah.
It is the answer, but it's the right answer. I think because sometimes we think separately, also on the opposite side, right? If you don't have good health, then it doesn't allow you to we all know the students, and Horatio knows this, Jonetta and Calaia don't know this, but I was a high school teacher and right out of college. And I remember the first thing was I had a student who was brilliant. She was brilliant, but she had really bad asthma and she missed a lot of school. And I knew she was a brilliant student, right? Because she was passing even with missing as many days as she did, but it's because we couldn't get her asthma under control, right? And so this connection not only between what education can do for you, but what if you are suffering from a chronic disease or something where you cannot get the care that you need to get, how it then impacts your school time and your ability to be present in school. So we can talk about things about, kids having accurate housing. I live in New York City, and one of the things we talked about was how homeless kids, in particular, were not doing as well in school because they couldn't sleep, right? And so it's not that they weren't going to school, it's not that they didn't want to do well, it's because they didn't have the ability to get a good night's sleep because they were in a shelter or they're somewhere where they were not stably housed. And therefore they couldn't function the same way in school. And so I want to talk about something that goes in Calaia's research, but also what Jonetta said about what happens to particularly Black and brown kids in a situation like that, where it's not that they're misbehaving, it's not that they are not smart, because we know they are, but they have these other social determinants, right, that are impacting their ability to do well in school. How do we support or think through what they need in order to help them to be functioning and healthy to go through a healthy school day? Or how, and in this case, like, how does being a Black and brown, impact their ability to get access to the resources they need to function and survive?
I can kind of jump in, and I'm sure that Jonetta and Horatio have other perspectives on this from their research too. Some of the ways that I think, especially through discipline policies and practices, that there are a lot of inequitable outcomes of having, zero tolerance policies that inequitably and disproportionately affect students of color, through educator bias has been something that folks have documented impacts discipline outcomes because of subjective experiences of inappropriate behavior, what educators perceive to be inappropriate behavior, and not having really that trauma informed kind of perspective of discipline, and taking a restorative approach to discipline. So I think that's sort of where I've kind of been working in my dissertation to look at, how do the policies and practices really allow for discrimination and racism and bias to be part of the process of being educated, rather than being kind of education being that protective space and the system providing those protective measures of allowing students to just be kids and grow and develop as adults.
Like, can you explain trauma-informed discipline and then also restorative? You said something about, I think, either restorative discipline or restorative. Can you explain what those are and why they're so important, particularly in our communities?
Yes, so I think restorative justice is really kind of presented as like the parallel to zero tolerance of, saying there's like 3 strikes and you're out, rather than saying, for example, there's a fight, instead of just saying both students are suspended, you really bring those students together, and it's focused on building trust and building respect in relationships versus, just punishment and criminalization, kind of just and really seeking to make whole a situation, I think. Trauma-informed discipline is something I'm not exactly very familiar with, so I'm hoping my fellow panelists can kind of help me out here. But I know that it really it means that we are acknowledging that students come from all types of backgrounds, that there are lots of situations that kids come to school with. If you start the morning and have already had a whole day before you've even gotten to school, you take care of your younger brothers, or you have, you live in a community, that a race and class subjugated community that might have violence in the community, or you might experience violence at home. And so having that perspective that I'm not going to just look at what the kid is doing, I'm going to think about, like, why are they doing that? And maybe, kind of dive a little deeper. So not exactly the like research-based explanation of that, but.
That sounds right. Jonetta?
So I cannot jump in with a definition of trauma, of the trauma-based side of things, Calaia, but I can offer what my perspective at CDC, right? And to your question, Lydia. And so I can answer it in several different ways. So we have the Youth Risk Behavior Surveillance System. And on that survey, we are able to ask a host of questions to students at the local and national level. And we've asked questions on racism, we've asked questions on connectedness, we've asked questions coming up new on the survey this year, unfair discipline. And through that, we're able to provide a baseline, right? We're able to see differences in students based on race, ethnicity, based on gender identity, based on based on sex. And that allows us to come to schools, to educators, to districts with information, right? And so I think it's important to approach school leaders, principals with information. So not all students are coming from the same environment. They're not getting the same start, right? Whether it's a community, an individual issue, family level issue, societal, it's important to realize that students are entering a space at different levels, and the data help us do that. And so that's one of the things we really try to push and promote through several ways. We have papers, of course, right? We like writing papers with the hope that people will read them. But in recent years, we've also started producing what we call the Data Summary and Trends Report, which is a really user-friendly way to access a lot of our variables in the survey and look at patterns and trends by demographic factors as well as over the years. And so that's an easy way that we've started helping to try and communicate these results. How are students doing in your state, in your district, nationally? How does that compare nationally? And then once we are able to hopefully get people to understand, hey, not all the students in your school are doing well, right? They're not on the same level here. We have programs in place, or our strategy rather, is to help school leaders and districts in 4 key areas, I'd say. And so one is at the community, right? So community connections. Another is promoting healthy school environments. A third would be health services. And then finally, school-based education. And so through those 4 areas, we really try to work with school leaders to drill down on here's how you can help students in your schools and your districts approach an even playing field. And I know all of us on this call are very familiar with the words even playing field and getting students to start to try to have access to needs and to services and education that puts them and propels them off to a good start. But those are some of the ways we do it at CDC. We also have a strong focus on mental health and have recently come out with a mental health action guide that also provides schools and school leaders in districts with strategies on how to improve that for students in their districts.
So I have 2 follow-up questions. One is, what are you seeing as the trend of what kids are saying? Because this is the one thing the great thing about YBRSS, which is the acronym those in public health use for that survey, is that it is the kids that are taking it, right? And then what they're saying is the problem. So what are we seeing? And yeah, I'll start with what are we seeing, and then maybe we could talk about as a group about like how do we think there are ways to help other ways besides what the work that CDC already is doing to address some of these issues. But I would love to hear what the kids are saying about racism, about out of school, about discipline and those kind of factors.
Yeah. So I'll drill down a bit, Lydia. And so I'll start with racism. And as she mentioned, it's the Youth Risk Behavior Surveillance System. And so it's the surveys that go out. We have a national and state base. And so by and large, all students report some degree of being treated unfairly based on race. And so multiracial Asian and Black students, over 50% of those students reported this in 2021. And actually that survey was our COVID survey. That year got thrown off by the pandemic. And so we did another survey called the Adolescent Behaviors and Experiences Survey, what we call ABES. It's very similar to YRBS, but was done during COVID. And so that survey showed that those groups, those racial ethnic groups I just mentioned, have reported higher levels of racism. That was also linked to poor mental health, right? So students from those groups reporting racism had poor mental health than students who did not report racism. And so that's on that racism variable. If you take it back a step and you look at mental health broadly, there are disturbing trends in mental health among high school students. Surveys high school students in this country. And so that's in 21, that's in previous years, and that there's a pattern that is not improving for mental health. We also have a variable called skipping school due to feeling unsafe. And we see patterns in that variable also, whereas Black youth and other youth of color have higher levels of skipping school due to feeling unsafe. And that's at school or on their way to school. So Horatio, that gets to some of your social determinants of health, the community environment. Our question on unfair discipline, that data will be released in 2023 or later this year. And the 2023 data will be released later this year in the fall or in 2024. And so I can't comment on that just yet, but I'm hoping folks stay tuned for those exciting results as well. But yeah, by and large, we are not trending in a positive direction for youth on the whole, and especially for racial ethnic minority youth.
So to bring everybody back into this conversation, Jonetta talked about one of the 4 areas they work with is community connectedness. So Horatio, can we talk a little bit about kind of out of school time, what's happening in communities, particularly policy and advocacy wise, to support or to combat what I think the data is showing, that, you know, this issue, and I've heard this a lot actually, of kids on their way to school, the problem that, and then not feeling safe in school itself, which is supposed to, as I think Calaia said, to be this protective, or at least we hope school is this protective environment for them. And it's not. So I would love for us to talk about what communities can do and what's happening in communities to support or maybe not support kids in this kind of way.
Yeah, certainly. I mean, you know, one of the biggest things, and as my role says, I believe in the power of advocacy to kind of change the situation, the context within which people live and are being educated. So, you know, a number of our affiliates engage in education, youth development, policy, and advocacy work, and we do that too. When we look in the out of school time space, one of the things I think is really important for young people is to have a more kind of holistic, you know, developmental set of opportunities. And so, you know, one of the things I actually want to call out that we've seen building up recently, and this is very much related to the intersections between out of school time, but also the traditional K-12 system, and that is what we call wraparound services in schools, and one specific model being the full service community schools program, which is funded by the federal government through a grant program. And essentially, these schools are set up to provide and house all of those resources that young people oftentimes, especially Black youth and low-income youth, don't have access to if it were not for the school. So access to physical and mental health services, access to the Health and Human Services Department, potentially workforce department if they need other opportunities to support, you know, income generation for their families. But these types of schools that provide these wraparound supports are not only just looking at, you know, what's going on with the young person in terms of what their current status is of their health needs, of their educational needs, but also thinking, you know, from an ecosystems kind of perspective. So they are also there to provide resources to the family. So you have issues going on potentially, or assets also with the young person, but then you also take a step out and look at what is going on with the family. And so providing resources to the family to also support the youth in terms of their development and their access, ideally, to high quality education out of school time supports, which then builds out more and more to the community. So these full service community schools, oftentimes these other schools that provide wraparound services actually have a dedicated person and a dedicated office that are there to connect people to those different sets of resources. So they're consistently maintaining connection with the young person and communication with the young person and their families to understand what their challenges are that they're facing within the school system, but also more broadly as we talk about those other social determinants to try and provide that more holistic support for young people. And so that's just one sort of initiative and set of strategies that a number of schools and districts have taken on with support from federal and state governments to ensure that young people have those more holistic supports to ensure their healthy development.
Calaia?
Well, yeah, I'm really glad that you mentioned and talked about the wraparound services. I really do think that that's like one of the most promising policy opportunities and spaces that we can hope to advocate for. That, you know, in my like perfect world, schools would be the hub of a community where, there's a library, there's school-based health centers that provide services to the students and schools, but also to their siblings, to provide that safety net that really is the goal of public education, and to really do those things. And I think, of course, advocating for those funding to fund those things, because I think inequitable funding is one of the major mechanisms that is truly driving inequities in schools on all levels, and really underinvestment in communities that are under resourced, and so I think, yeah, moving the needle towards providing more wraparound services and more school-based health centers, and really community engaged policy making is what we need.
So I'm gonna kind of base off a point. Well, actually, I want to ask Jonetta one point, and then I want to go off of something that Calaia just said. So when you talked about that community component to the work that you're doing, how receptive have communities been? Have districts been to the work that CDC is doing? Because I can see people being like, why are you in this? You're supposed to just provide us the school health clinic or whatever. You know how people get very siloed. So what has been the reaction, and what has been the hopefully positive or the outcomes of some of the work that you all have been doing with communities, not just the students themselves, and the school-based clinics, but actually working with the districts and the community?
Thanks, Lydia. And so, yes, so our work is more so providing recommendations and strategies, right? And so I'm on the surveillance side in our adolescent and school health division. We also have a program side and our research and evaluation side. And so partners and colleagues in those divisions get a bit more kind of face time with schools and districts who are actively implementing our programs, and we're actively evaluating how their strategy, how it's being carried out, how it's done, what were the results. And so I can't speak too much to that level of detail on how effective it is, but I can say it has been effective on a broad scale, and that's what helps us to then turn around and refine our strategies and develop these action guides. Right. So once we have this kind of case study of these from schools who have implemented our programs and we see success, we're able to then turn that into, here's an action guide, schools, for how to promote mental health, right? For how to work through these 4 strategy areas to improve student health and well-being on a whole level. And so through those, some of those strategies for community connection kind of tie well with what Calaia and Horatio were saying. So for community connection, we really promote engaging the entire community. So whether that's giving the community access to a fitness facility, if there is one in the school, or a library for the whole family to use, if there is one in the school, putting that's in that strategy. Also, for promoting student health and well-being, I think it was Calaia who also mentioned referrals, right? So we promote schools giving referrals for students to health services. We ideally would love for those to be in schools, but if they aren't, providing students access to referrals or having in-school based providers. And so those are some of the ways we're able to take the results from our kind of studies that happen, or research implementation projects that happen across the country, and then on a higher level, use those results to push strategy. And so that's that. And I will say, we have the data arm, and that highlights the problem. And then it goes to the practice program arm, and they implement strategies to help fix the problem. And then we're able to push out strategies and action guides on a higher level.
I love that. That's because I think it's important for us to see, one, government at work, right? Like, these are our tax dollars that are supporting the data, because data, sometimes we talk too much about data or we don't talk enough about data, but knowing what's going on is important because then you can take action, right? So your division then brings it to the programs folks who take some action to figure out, okay, I know this data. Let me figure out what kind of maybe programs or activities. Let me see what schools are doing in the, ecosphere, and then come up with best practices, right, from what's happening. I want to go back to something Calaia said about educational inequities. And I want us to talk about the connection between educational inequities, health inequities, and how do we use education to advance health equity as a larger kind of issue. And so I'm trying to be positive because, we talk a lot about what's not going right, but there is stuff that are going right. And so how do we talk about how education can reinforce health inequities or can help to dispel health inequities?
I'll jump in a little bit. Yeah, so we've already, kind of talked a lot about, school-based health centers. I don't know that we've like really discussed them, as much as like the losing my word, but how many there are. There really aren't enough of them. So I think that that's one of the things that we can do. If we could provide more school-based health centers, it's because they are so effective. The research shows that they are very effective at bringing services to students. So I think that's one of the things that education is doing really well. Another thing that I think that we're doing really well is moving towards, and I know it's kind of in the news, it doesn't seem like there's much movement towards like more inclusive curriculum, but providing more inclusive curriculum. And there are a lot of folks that are staunch advocates for having more, diverse and representative curriculum. I think that those are two levers I've really kind of latched onto as being like bright lights in the system.
Horatio?
Yeah, no, that's great, Calaia. Thanks for bringing up those along with the earlier conversation on discipline and the sorts of reforms that seemingly are having positive effect. Just to take it back just one step, racial inequities in education opportunities and outcomes are pervasive. Black students face disproportionate barriers to academic achievement and success. And that manifests itself in many ways, some of which you've already talked about, like less access to high quality schools, schools with adequate resources, with experienced teachers, with access to advanced coursework, the discipline disparities we've seen. We know that Black, brown and low income students are suspended or served detention at disproportionately high rates compared to their white and more affluent peers, even for the same infractions within the same school. So that goes back to the implicit bias challenges we're facing in the educational system that Calaia brought up. One of the things that I would really just want to talk about is some of the underlying factors kind of contributing that. And I think Calaia, hit the nail on the head with talking about issues related to funding. If we talk about historical, systemic, and present day factors kind of underlying these disparities, we have to talk about institutional racism, right? And we just passed the 70th anniversary of the Brown versus Board decision, which said that separate but unequal facilities were inherently unequal. So what it did is it struck down segregation laws across the country and led to, for a time, the integration of schools. And, there's nothing magical about a Black kid sitting next to a white child and the benefit of sitting next to a white child and learning, right? But it was really a conversation and a series of court cases leading up to Brown versus Board that was about unequal resources and facilities, materials, extracurricular opportunities, which we talked about. Prior to Brown versus Board, Black students were going to, high school students, for example, were only being able to go to school for half a day because they had overcrowded schools. Materials, getting outdated textbooks missing pages, and lack of those equitable opportunities, in terms of out of school time as well. We see those vestiges still today. Schools serving predominantly Black children get $23 billion less per year than schools serving predominantly white populations. And so this is in many ways intentional design of an inequitable system. We built a system of school funding that is reliant on what neighborhood you live in. And so the school funding system essentially adopted all of that entrenched racism that incentivizes people to make decisions that end up driving inequality and inequity. So we have those challenges, but there are positive things going on, as Calaia said. We can just talk about funding. In 2013, California passed a new funding formula, which really was tied to the level of poverty in a school. So higher poverty schools would receive even more dollars to provide young people with more equitable opportunities. And we know kind of what the intersections of the statuses of Black people related to, on average, related to socioeconomic status. So it is kind of an equitable policy to ensure that schools serving greater percentages of Black and brown young people are actually receiving more funding. And we've seen positive impacts of that funding on educational outcomes. And we know what that means in terms of people's long-term health and their ability to access those sorts of services to make sure that they have a more robust life. And now in 2024, they're looking at making even more improvements to that funding formula. So really excited just to see that not only in California, but other states like New Jersey and PA, we've seen court cases now, and now the policy is going to have to come behind that to ensure that funding is equitably distributed across populations.
You got Horatio. This is why Horatio and I are such good tag teamers, because he got exactly. I was going to ask the next question I was going to ask was about tax base, how we pay for schools. Why are schools underfunded? And you just got to the answer, which is it's based on a tax base and the tax base of the community, right? And so if the community has a lesser tax base, then that's why there's such a fight. And this is going with our social determinants talk about, that's why housing is so important. Where you live matters where your kids go to school. And where your kids go to school, the tax base in that school matters for what the resources that school has, which is why people fight over housing so much and making sure they're in a good school district. If anybody watch House Hunters, the big thing is it a good school? I watch a lot of House Hunters. Is it a good school district, right? Because I'm going to pay more money for this house so that my kids can get into a school district that has more resources, right? And so that inherent in that system is inequitable. And I think it's important for us, and the California example is the great example about equity means that sometimes some people have to get more because they are further behind in order for them to do better. And that's not a bad thing. That's actually a good thing. People are now making kind of this equity argument as an unfair argument, but they're starting at an unfair advantage, and that's the whole point, right? And so I do want to talk a little bit more about Calaia's comment, which I think is a great one, about we need more school-based health systems. Jonetta, I don't know if you can answer that, but what does CDC feel about that? What is kind of the barrier to that not happening? Because we do know, particularly in states, for example, that have not expanded Medicaid, that we know that there are a lot of kids who are not getting access to care because they can't. And the school is the only place that they can get access to care, which is really important. So I do want to address this access to care issue.
Thanks, Lydia. And just to follow up on the previous point, one of the things I always like to point out is even when a Black or brown racial ethnic minority family does get a house in a great school district, you also have to have educators who are going to see and nurture and promote a healthy school environment for that child. So wanted to just bring that into the discussion as well. But our stance is definitely we support schools in implementing having school-based health centers. That is something that is proven to be effective in providing students from lower socioeconomic backgrounds, getting them service, right? So whether it be for sexual services, sexual health, right, mental health, we know that racial ethnic minority students and students from lower socioeconomic backgrounds don't have access to those services, and schools are one way that we can provide those services. So we support it. We are not in the position to actually fund the clinic and put it in the school, but we do work with districts to give them the information they need to know that it's a great choice to support the health of the students in their school or district.
And also I'm gonna say dental care, which we know is another problem that is huge, that is impacting particularly low income students because they're not getting access. And we know what happens when students have cavities early. And, you know, I was remember working in the state when we had a student who actually passed away because they had a tooth infection and couldn't get to a dentist. And it infected their brain and the student passed away. And so I remember the kid's name. I remember it when it happened because it was really unfortunate. A kid shouldn't die from having a tooth infection, a cavity that gets so bad. I do want to go back to, actually, Jonetta, you actually positioned me for my next question, which exactly is what you're talking about, is this connection between the school environment, what our kids are experiencing in the school environment, whether the school environment is nurturing to their well-being, whether we're talking mental or physical well-being. And so I want any and all to talk about why that's important and why it's not happening, if you can answer it.
I can maybe get us started a little bit. So the view that why these experiences are so important is because from a very early age, there's a compulsory law that you attend these buildings, you go to these schools with teachers that, you know, give you rules and ways, things to do and tell you how to stand, and, you know, and you make friends there, and it's really positioning us in the bigger scheme of like how we're going to move through the world as adults as well. And some of what my advisor and I kind of think about is like, how do these experiences tell you where you stand in society? You know, are you being subjugated? Are you being subjected to these experiences? Are you being, you know, developed and nurtured? And how are those experiences going to, you know, I still remember what it was like in third grade, you know, and I think, not to get too like sentimental and anecdotal or anything, but I think that those experiences matter for how we decide to be part of a community, or and, you know, also whether or not, just in the like purely empirical sense of like, are you pushed out of a system? Are you then moved from like the education system into the criminal justice system because of, you know, excessive suspensions and expulsions and that kind of thing? But then I think even less from like just the relational perspective, school buildings in the country are actually very old, and if we're wanting to provide a healthy environment, a lot of schools are in need of remediation and renovation of their HVAC systems that can provide that healthy air quality, that especially, you know, as we saw during the COVID pandemic, is really necessary for being able to go to school every day and learn in a healthy environment. So some of it kind of goes back to funding, but underfunding of school facilities is an issue too that we can address. Yeah, I'm just not rambling there.
No, thank you, Calaia. I think that's a good point to talk about. I mentioned before, I went to school in New York City, and those buildings are old. They're very old. And I remember when I went to school, and I'm not that young, they were old. And those are still the same school buildings that are being used now. They're building additional buildings. But so it's not just about the mental environment, it's the physical environment, right? Making sure that our, you know, whether it's lead paint, whether it's air conditioning, dealing with heat. We all know that climate change and climate issues are happening where it's getting warmer earlier. And so having students in school buildings that don't have air conditioning or don't have windows that can open is a health hazard for how they live, you know, they learn. So I thank you for bringing that point about the physical environment of where kids are learning is also an important impact on their health and their learning. Horatio.
Yeah, I was just gonna piggyback on some of the things Calaia said, and I think she was absolutely right with those two kind of pieces, the psychological safety piece and then the what we'll call the healthy school facilities piece, right? And so you mentioned it, Lydia, like I live in Philadelphia, for example, and without doubt, every year we hear of a handful of schools that have to close because they found damaged asbestos, and those kids are either then learning at home or they're being transferred to another school. So they're having their educational opportunities disrupted because of the lack of healthy school facilities. The same thing goes with issues with lead. We still have lead in our drinking waters in a number of our schools, especially schools serving predominantly Black, brown, and low income youth. And there are actually things that can be done about that in pretty cost effective ways. And it first starts with, though, kind of going back to what Jonetta said, of knowing the data and having the data there, right? So actually ensuring that our schools are and districts are actually testing for lead, for example, which is a very low cost thing to do. And then there are pretty low cost remediation processes that you can do when you find a fixture that has, proves that there's lead in the water. And so healthy school facilities is something that I think is something that's not talked about often. But, we talk about chronic absenteeism, right? As a students just generally being disengaged from their learning, but we don't often talk about chronic absenteeism related to young people's health and the environment that they are in when they are trying to learn. So I think that's, another thing just to think about in terms of, the advocacy that we can put forth to ensure that our young people have equitable learning facilities.
I don't know if you have anything to add, Jonetta. Yeah.
No, I'm just thinking back to this conversation, back to our beginning, right? And just how linked education and health are in terms of equity and access, and the community social determinants of health, right? And so following up on Horatio's last few comments, the environment and how much that structures access, whether it's the physical location or what the student enters the school building carrying, right, mentally, socially, that day, physically. So that's a wrap for me.
No, I appreciate that. And before we do have a question in the chat, but I do want to ask a question because we've been talking a lot about this issue of safety, right? So we talked about kind of psychological safety. We talked about physical safety. There's this other component that I know that those of us on this call, it's a larger one to deal with, but there's this issue particularly that has been bubbling up as we've been talking to affiliates of gun violence and that kind of safety. So that whole idea of on the way to school, but also in school, right? People bringing in weapons because they feel unsafe. So I don't even know how to answer this question or even ask the question, to be honest with you, because it's such a large issue and we know there's lots of reasons, but how do we begin to address or think about this issue of gun violence and safety for our students, not only in the neighborhoods they live in, but in the school environment? Not to get anybody in trouble, but I'll start with, we have to do some regulation on guns. I'll put it out there. I'll just put it out there so that nobody, I know, because I know Jonetta may not be able to say it. But also too, just on another note too, we have to do research, right? The other thing too, we're not allowed, there's not that much data out there because there's been some lobbying about, it's harder for people to do research on guns and gun violence and the impact of that. So the CDC gets kind of, their arms tied because they don't have the data to back it up, but then they're not allowed to do the research or pay for the research to have the data to back it up. But it is also, I'm going to throw it out there because I can say it, that, limiting guns, but what are in the environments you are in thinking about it, how are we thinking about gun violence and how are we thinking about supporting our students around this issue?
So I'll jump in at a very high level, Lydia, and just let you all know and all the affiliates on the line that the Youth Risk Behavior Survey always has an open call for questions. And that happens, and so we're preparing our 2025 survey right now, and we had an open call for questions late last year. And that's, you can be at CDC, you can be external in the academy, you can be at a nonprofit and submit questions for us to consider for the upcoming survey. So at a high level, we do have an open process for how questions get on our survey and then go out to collect data and research from students.
So I'm going to read between the lines. I'm going to say it because she can't say it, but I'm going to say it. I think it's really important. I think this is a really important point and something that I probably, even as the person who does health here at National Urban League, didn't know about, that we can submit as a collective, as affiliates, a question like a question. So I can get with Horatio and with Calaia and with all of the affiliates. And if 10 of us or 15 of us submit this question, they may not be able to put it on it, but they have to at least investigate. And so I think that was, the point is, we should all be submitting a question maybe about gun violence for us to possibly get on this survey. And so I'm actually going to connect with you afterwards, Jonetta, so I know when that time is, because I actually think that's an important, I think Horatio and I should get together to think about the important policy aspect of how do we get this question submitted so that we have this evidence to make this argument. And so look right here on this call, we have just taken an action or thought of an action we can take around how we can improve or help or think about the health of our students when it comes to this issue, which is gun violence. So I'm going to say that. I think Calaia, Horatio, anything about issues around gun violence?
I'll just say one thing. Obviously, as you said, Lydia, it's a pervasive issue of lack of gun control, especially when you talk about interstate movement of illegal weapons. Thinking more closely to school and out of school time, one of the big challenges that parents face when they are making a decision of what out of school time program to enroll their child in, or a young person is thinking about, and this report comes from the America After 3 p.m. report. It's from the After School Alliance and has a number of funders behind that, but basically they've found that parents are saying that the lack of a safe way to get to and from program sites is one of the factors behind them choosing not to enroll their child in an out of school time program. And so one of the kind of policy levers and ways that we can think about supporting that movement to school and from school to out of school time, or out of school time to home, is in terms of, again, advocating for funding specifically around transportation. So I know a number of states, but also like municipalities, the intermediaries that oversee out of school time programs have created set-asides for transportation to allow people to purchase buses or vans, or for the out of school time programs to create partnerships with schools to ensure that young people can actually get directly from the school site to where they need to be, to that out of school time place. So just thinking around ways that you can mitigate these issues of getting essentially sometimes that last mile to and from school, through connecting with community partnerships and your local municipality to really advocate for better, safer transportation.
That's a great point, Horatio. Once again, it's not about, you would think it's not about, I would have never thought it's not about, I thought maybe they couldn't afford the after school time activity. It's not even about the activity. It's about how can my kids safely get to the activity, which is not something that you always think about, but I think it's a powerful point about how all these things are interconnected. It's not just getting the kid, it's not just paying for the activity, it's how do I get there and make sure my kid is safe and then can get back home safely, which is, what most parents' concerns are. So I think just but also the creative solutions, using transportation, being allowed to buy a bus so that I can pick the kids up and bring, like having solutions that work in order to solve this problem for parents of getting their kids to the activity. So that's wonderful. Those are wonderful. Oh, I got 2 questions in the chat now. Oops, I missed one. So I'm going to go with the first question because I think I'm not sure this group can answer it, but I will throw it out there. I'm going to try to rephrase this a little long, but it's basically talking about there's different styles and modes of people and how they learn, and how do we think about our educational system currently in a way that promotes different learning styles and not just this idea of memorization, because that also, just to bring it back to the health aspect, for kids who that's hard for them, that's also a confidence and a mental health issue to feel like I'm not learning well, right? It makes them sometimes, feel like they're dumb. No kid is dumb, right? That's what I used to tell my students. No questions is a bad question, and no kid is dumb. But when you are feeling like everybody else is getting it, but I'm not getting it, that's an issue that can deal a lot with that mental health. So do we have any thoughts on how do we change Common Core curriculum, which I know is a huge question, to help those with different learning styles?
a huge question, and definitely thoughts. But I think, you know, for the sake of time, I kind of mentioned, you know, inclusive curriculum and movements towards having a more diverse range of options and models of learning. And, you know, of course, there are trade-offs with like school choice models, but there's certainly a value add to like innovative solutions to thinking about like making curriculum more relevant and more representative and really not teaching to a test, but teaching to the students and teaching to their needs and really bringing about like that kind of approach. Yeah.
Mhm.
And I would just add, you know, you should be, or we should be looking for opportunities to inject project-based learning. And so, you know, you can think about from, again, from the advocacy space, you know, but also as a parent or a caregiver, trying to understand like what you said, what's going on in the classroom. Are they just doing this rote memorization, things like that? That's really, in my mind, so what Zaretta Hammond says is like cognitive redlining, right? It's just like for creating these barriers for kids to learn in the multiple modalities that they learn best in. And community-based organizations can be central to this, and the workforce can be central to this as well. So you think about community, workforce, school partnerships where you can bring folks in from outside of the school to support instruction in different ways, but also getting young people as much as possible outside of the school. So thinking about the different pathways folks, young people might have to be able to learn in different ways.
And I would even add using the tools of the school. Like if you know, I was a biology teacher and thinking about how you use the school-based health center and what they're doing to make and to have kids understand you have a professional there who had to use science to get their job, right? And so how do you incorporate, you know, the healthcare system and other systems into the learnings for the students in ways for them to see it, you know, and that was one of the things, you know, I tried to do when I was a high school teacher, was like, how do I get them to see it a different way? How do I use different modalities? And you're right, not everybody does that. Some people just want, and people are very resistant, right? People who've been in the workforce for a long time. I have a cousin who's a superintendent, you know, have teachers who are very resistant to change, right? But kids learn differently now, and we cannot teach them the same ways that we were taught because it's not how they learn, right? So I think that's another piece. So we are 1 minute before the hour and we're gonna almost end, but the second questions, I don't know if it's a necessary question for the group, but I will answer Angela, who said, I think, Jonetta, this is a question for you, because she asked a good question. Should we come up as a group with one question to submit, or should we submit a bunch of questions around this issue of gun violence? What do you think would be the better strategy for being able to get, you know, think through how we get this question possibly added?
There's power in numbers, and excuse me, I'm having a coughing fit off to the side here.
No worries.
But there is always power in numbers, and there's really no limit. So if there's one question, if there's several questions, I didn't mention earlier, but we have an optional questionnaire so that if a question doesn't make it on the standard survey sites that are not part of the national survey, can always pick up these extra additional questions and put them on their survey. And so the more questions you submit, that's more that can be placed in other areas potentially. So no hard and fast answer or rule there.
Okay, perfect. So Angela, I think we'll be doing both. We'll be working, coordinating to make sure we maybe have one question that we all submit, and then getting the affiliate movement to think through about other questions. There's one last question, but we are actually out of time, but let me ask it real quick. What is our stance on implementing policies around more efficiently controlling the content that is influencing our children's mental health and behavior? Oh, societal content and social media can be extremely inappropriate and can breed negative behaviors within the classroom. So anonymous attendee, that is a very weighted question that I don't think we have time to answer in this 1 minute that we have left. But I will say that I think it's a larger, broader question that society we need to think through. And I think schools are thinking through them, are starting to think through them. But it is a huge issue that we have to think about. And we are seeing the research showing that mental health, that social media has definite impacts on the mental health of our students. And so how do we help support them? And not because there's good things about social media too, but being able to recognize you know, the differences. And that's that might be another webinar for itself. So we might want to think about that. I just want to say it's one-on-one. I want to respect everybody's time. Calaia, Horatio, Jonetta, thank you so much. I can't believe this hour went so fast. I have so many more questions, but just thank you so much for your knowledge and your willingness to be here and for helping us to think through. I'm sure you're going to have other questions and get emails from other folks, but just know that this will be on a YouTube page, and I will do follow up with both of you, with most of you. Well, I see Horatio all the time, but with Jonetta and Calaia, about the work that you're doing so that we can help our affiliate movement further this work. So thank you so much. Have a wonderful day, everybody. And I will see you next month for another webinar series for the Health Equity Webinar Series. Thank you so much. Bye-bye.